Welcome to the deep dive. We are here today to tackle a really important topic, panic disorder and panic attacks. It's something many people experience, often silently. Our sources give us a good picture, clinical views, personal stories, recovery paths. So our mission for you, the listener, is simple. Get the clearest possible understanding. What is panic? How does it actually feel? And crucially, what helps you get back in control? Let's shed some light.
Absolutely. It's so needed. When we talk about panic disorder, fundamentally we're looking at an anxiety disorder, but it's characterized by these sudden, really intense bursts of fear, terror even. And the key thing often is that these attacks seem to happen without any clear, immediate danger. No obvious reason.
Okay, so how do we draw the line? Everyone feels anxious sometimes, right? Before presentation, maybe worrying about finances.
Exactly. That's normal anxiety. It's your body reacting to stress, to pressure. That's, well, appropriate. Panic disorder is different. The fear here is sudden, it's repeated, it feels completely overwhelming, out of control, and it can hit any time. You could be relaxing, driving, just sitting, having tea. It feels like an ambush.
Right, an ambush. So let's unpack that. If someone listening has had scary moments, how do they know if it's, say, just a really stressful situation? Or if it's crossing into this disorder territory, what are the patterns they should be looking out for?
That's the crucial question. It's about the pattern, this kind of feedback loop of fear. Our sources point to about 4 key signs that suggest it's becoming a disorder. It's like the reaction itself starts causing the problem.
Okay, what's the first sign?
First, you're having repeated panic attacks. And importantly, they often seem to come out of the blue. No obvious stressor needed to kick them off. Second sign, and this is mentally really tough, you start constantly worrying about the next attack. When will it happen? Where? This anticipatory anxiety is exhausting.
And I guess if you're always worried about the next one, you start changing how you live to try and stop it.
Precisely. That leads straight into the third sign, avoidance. You start actively staying away from places or situations you think might trigger an attack, maybe avoiding crowded markets or driving alone, things like that. Your world can start to shrink.
I see. So it builds on itself.
It really does. And that brings us to the fourth sign, which is almost the core of it, this fear of fear. The stress and worry about having a panic attack actually makes your body more tense, more ready, basically more likely to have another one. Avoidance is really what locks that cycle in place.
Okay, this really brings us to the physical side of things. Because the symptoms, they sound so intense, so dramatic. We hear stories, don't we, of people thinking they're having a heart attack, rushing to the hospital. What exactly is happening physically that feels so terrifying?
Well, the symptoms usually peak very quickly, within minutes. And yes, they feel absolutely terrifying because it's essentially your body's fight or flight system going off massively but inappropriately. So you get that racing heartbeat, a pounding heart, often chest tightness or pain, difficulty breathing, maybe feeling like you're choking. These heart and breathing symptoms are exactly why people fear the worst, like a heart attack.
And it's not just heart and breathing, right?
Yeah.
There are other physical things too.
Oh, yes. A whole cascade. You might get intense sweating or uncontrollable trembling or shaking, feeling faint, dizzy, lightheaded, sometimes a dry mouth, nausea, or your stomach churning, hot flushes or sudden chills. Even strange sensations like numbness or tingling, often in the hands or fingers, all these signals scream emergency to the person experiencing them.
And on top of all that physical chaos, there's the mental state, the emotional side.
Absolutely. That's just as overwhelming. There's this intense, acute fear of losing control completely, maybe fear of going crazy, or even fear of dying. And another really common unsettling feeling is depersonalization or derealization.
What does that feel like?
It's feeling detached, like you're watching yourself from outside your body or feeling like the world around you isn't quite real. It's very frightening. But interestingly, it might actually be a kind of neurological defense mechanism. The brain trying to cope with what it perceives as an extreme threat.
Wow. So the body and mind are in full-blown emergency mode.
Exactly. But here's the absolutely critical point we need to stress. Even though they feel catastrophic, most panic attacks are short-lived. They usually peak and start fading within, say, 5 to 20 minutes. Your body simply can't sustain that level of physiological arousal indefinitely. And crucially, despite every feeling telling you otherwise, these attacks are not life-threatening. It's like a faulty alarm system, not a failing organ.
That distinction is so, so important. And we have a case study that really illustrates this, doesn't it? Makes it relatable. Yeah, think about Anjali. She's 32, from Patna, just traveling on a bus, nothing unusual, and then bam, Heart racing, can't breathe, hands shaking, convinced she's dying right there on the
A
bus.
classic presentation.
Right. And after about 10 really awful minutes, it just faded, gone. So she did the logical thing, went for a heart checkup, doctors ran tests.
And found.
Her heart was perfectly healthy, absolutely fine. But the attacks kept happening.
And that's the key. The physical check confirming wellness proves the issue isn't the heart itself, but this panic cycle taking over. The fear signal is incredibly powerful.
So what does lead to this? Why does the system become so hypersensitive for some people? What are the underlying causes?
Well, it's usually not just one thing. It's often a mix of factors. Genetics definitely seem to play a part. If you have a family history of anxiety or panic attacks, your risk might be higher.
Okay, so it can run in families. What else?
Major life stress is a huge factor. Things like a serious illness, losing someone close, a relationship ending, or experiencing some kind of trauma. These big events can kind of overload your system's coping mechanisms.
That makes sense. What about biology? You mentioned brain chemistry earlier.
Yes, research suggests changes in how certain parts of the brain function, particularly the amygdala, which is like the brain's fear center. In people with panic disorder, it seems to become hypersensitive, maybe triggering that fight or flight response too easily, even when there's no real danger. And just long-term chronic stress or worry can also prime the mind and body, making it more vulnerable to these misfires.
Right, so it's this combination, genetics, major stress, maybe brain wiring, ongoing pressure. Understanding that mix feels like the first step towards getting help. Which brings us to diagnosis. If someone listening thinks this might be them, what happens next?
The very first step, especially because the symptoms mimic serious conditions, is to rule out physical causes.
Like the heart issues we mentioned, or maybe thyroid problems.
Exactly. Doctors like those at MedRec Hospital Jehanabad mentioned in our sources will typically run basic medical tests first. Blood tests, maybe an ECG for the heart. This is vital for safety, but also provides important reassurance.
Okay, so physical issues are ruled out. Then what?
Then it becomes about understanding the pattern of the attacks. The doctor will ask detailed questions. How often do they happen? How long do they last? What exactly do you feel during an attack? Are there any triggers you've noticed? They'll also ask about your overall stress levels, your emotional health, what's going on in your life.
And this is where honesty is really important, isn't it? Even if it's hard to talk about.
It's absolutely crucial. Sharing those personal fears, the specific worries, the situations you avoid, it's difficult. But it gives the doctor the information they need to make the right diagnosis and find the best path forward.
Okay, so diagnosis happens. What about treatment? What helps people break free from this cycle? Our sources mention three main approaches.
That's right. The goal is to reduce how often the attacks happen, how severe they are, and give you back that sense of control. The first, and often the cornerstone of treatment, is talking therapy, specifically cognitive behavioral therapy, or CBT.
CBT, we hear that term a lot. What does it actually involve for panic?
It's very practical, actually. It's not just talking endlessly about your childhood. CBT helps you identify the specific negative thought patterns that fuel the panic. Like, for example, the thought, my heart is racing, I must be having a heart attack.
Right, the catastrophic thinking.
Exactly. CBT teaches you skills to challenge that thought, to look at the evidence, to reframe it. My heart is racing, I know this is a panic symptom, it feels scary, but it's temporary and not dangerous. I am safe. It's about changing how you interpret those physical sensations, taking away their power to trigger full-blown panic.
So it's like retraining your brain's response to those feelings, giving them a different, less threatening label.
Precisely. And it's very effective for many people. It's also worth knowing that sometimes you can self-refer CBT, for instance, through specific mental health departments mentioned in our sources.
Okay, so CBT is key. What's the second area of treatment?
The second area is medication. Sometimes doctors might prescribe medicines to help reduce the overall level of anxiety or the frequency of panic attacks. These might be antidepressants or anti-anxiety medications.
Is it usually long-term?
It varies. Often medication is seen as a tool to help manage symptoms, especially initially, maybe making it easier to engage effectively in therapy like CBT. It's often most effective when combined with therapy rather than just being used on its own.
Right. Therapy and maybe medication. What's the third piece?
The third piece involves lifestyle changes. These are things you can actively do yourself to support your recovery and regulate your nervous system.
Things anyone can start working on.
Absolutely. Simple but powerful things like cutting back or avoiding stimulants. Caffeine is a big one, also nicotine. They can directly trigger anxiety symptoms. Practicing relaxation techniques regularly. Deep breathing exercises are fantastic for calming the nervous system in the moment. Getting into a good sleep routine is vital. Regular physical activity helps manage stress. And importantly, staying connected with supportive people, not isolating yourself.
Hmm. So it's a whole person approach, really. Therapy, maybe meds, and these crucial lifestyle supports working together. This has been incredibly insightful. I think the main takeaway, for me at least, is that while anyone can develop panic disorder, it's absolutely not a life sentence. Understanding what's happening, knowing these treatment paths exist, and having support recovery is genuinely possible.
That's exactly the message. Knowledge really is power here. Understanding that the terrifying symptoms are essentially a faulty alarm system that helps demystify it. And knowing there are concrete tools like CBT and lifestyle changes to help you reset that alarm system gives you agency, gives you hope. Remember, knowledge is only truly valuable when you understand it and can apply it.
And let's circle back to that point from our sources about how hard it can be to talk about personal fears. If anything we've discussed today resonated with you, if you recognize yourself in Anjali's experience or these patterns, just consider the power in taking that first step, in sharing honestly with someone, maybe a doctor or a therapist. It really is the doorway to relief.
It truly is. Breaking the silence is often the hardest but most important step.
So please remember, you are not alone in this. Help is definitely available. Specialized compassionate care exists, including at facilities like MedRec Hospital Jehanabad. If you are struggling, please reach out. And if this deep dive offered some clarity or hope, please subscribe and share it with anyone you think might benefit. Thank you for joining us.